remarks. Now we move on to Ms. Kanaka Christina, who is the president of the Child Institute and a professor of pediatrics, endocrinology with the National University of Athens. Yes, thank you very much. Thank you very much for the invitation, as you said, as director of the first clinic of pediatrics of the University of Athens in Hagia Sophia Hospital. We do hospitalize children with cystic fibrosis, and we don't know. Okay, I turned the microphone on. Thank you very much. So, good morning once again. As Ms. Spino said, I'd like to thank her for her invitation. I am a professor of pediatrics and pediatric endocrinology and director of the first pediatric clinic of the University of Athens at the Hagia Sophia Children's Hospital. You all know about it. So those of you in Athens, it's the largest children's hospital of the country and of the Balkans. And in fact, we are in the same campus with the Department for Cystic Fibrosis. And on top of that, we have the Child Health Institute. And in the central building, we have the University Pediatric Clinic. So we have an interaction between the patients and our doctors and myself. As a professor of pediatric endocrinology, we treat our children with cystic fibrosis as soon as we have diabetes. Now, let me point out that already my own training and education was in Germany, and in particular in Switzerland, where we had a lot of cases and many different families that we had to help with members with cystic fibrosis. And it's with real pleasure that we see that the treatments have evolved. I'm here under my capacity as president of the Child Health Institute to announce to you that this year we have started in a pilot project a neonatal broadened screening test that includes cystic fibrosis in it. I've brought a presentation. My relationship with the Institute is going back many years ago because I was responsible for children with congenital hypothyroidism. Since 2015, I was the deputy president, and the president was Mr. Dudunakis. Already since that time, we tried to have incorporated in neonatal screening the cystic fibrosis, and as of 2020, I am the president of the Child Health Institute, and indeed we have been able to make a reality what is really important for timely diagnosis. Regarding the national program for screening of neonates, you know that as soon as a child is born, on its 4th day, we get the heel prick test, a few drops of blood that are sent to the Child Health Institute. So centrally, we have measurements both for congenital hypothyroidism as well as galactosuria, phenylketonuria, and as of September 2022, there has been the information of the Public Health Experts Committee and the Deputy Minister for Health, and they have approved of this pilot screening program that will be broadened. So you see the neonatal screening in Greece. It will no longer cover only the 4 diseases it used to cover in 1979, but in a pilot project we have added amino acid diseases, oxyurias, beta oxidation of fatty acids, and cystic fibrosis, which, the screening works really well, and you know that this was a gap we had to fill in our country. This pilot project will run until 2025, until we are able to show the positive results and until it's fully incorporated in neonatal screening. We see that in 2010, there were already states that used neonatal screening. This expanded in 2020, and we are really proud today to see it in our country. I won't be talking about the substrates of neonatal screening. As you can understand, as I have already mentioned, and in the same building, in the Doxiadis building. Well, Doxiadis was a really famous pediatrician who used to have faith in preventive pediatric medicine, and he was the one who organized the Child Health Institute. So on the top floor, we have the Child Health Institute, and on the ground floor, we have the cystic fibrosis floor. So as soon as we have a positive sample, there is a open contact and there is also the sweat test, and in the campus we have the molecular confirmation of the tests. As you can understand, the molecular confirmation does not belong to the initial screening, but there is a constant communication between the members, not only in the Attica region, but also elsewhere in Thessaloniki and throughout Greece. Cystic fibrosis screening has started as a pilot project 4 months earlier. It's working, and we have a very good communication between the treating physicians and the family. So I'll move on to the data here, because I want you to know that there is this possibility for early intervention. I see Mr. Dudunakis showing up, yes. And let us remember that the Child Health Institute, amongst the main works, with the help of the Ministry of Health, in general covers all these diseases whose early detection is of particular importance vis-à-vis the early onset of treatment. Because if we delay the onset of treatment, we have issues with all such diseases, because there might be irreversible changes. So we'd like to warmly thank the Ministry of Health for listening to our own needs and accepting to incorporate the neonatal screening in order to make it a reality and to be able to set diagnosis early enough, avoiding late diagnosis. Mr. Giginoudis is the coordinating director of the program for the National Neonatal Screening Plan, and it pertains to the entire country, whereas the heart and soul of this program is also Dr. Dimitris Platis, who implements this, who is a member of this screening program in Europe. And you can see a whole team of technicians, technologists, etc. The aim being for early diagnosis and treatment. So with these few words, I'd like to thank you, and allow me to point out once again that as a member of the National Committee for Rare Diseases and as a member of the working group of the Ministry of Health for Rare Diseases, our aim is for all rare diseases to be treated in Greece and to be given timely diagnosis and treatment. So I'd like to congratulate your association, and I bid you a very good morning. It goes without saying that our cooperation will be continuous. Thank you.